Late period and a negative pregnancy test. There are so many reasons women have missed period, yet they are not pregnant. Statistics has it that 14 to 25% of women miss their period, yet they are not pregnant as a result of range of conditions. All you are going to learn in this video. Please do not skip any of it. Watch to the end to learn. Do not forget to give this video a thumbs up and subscribe if you have not. In this channel, I teach about the good lifestyle, that which you need to do to stay healthy, enjoy your life, and maximize it. If it's kind of content you enjoy watching, please subscribe to this channel and stay tuned. Watch to the end. Turn on your notification bell to get notified whenever I upload a new video on your health matters. All right, the first thing that causes missed period is amenorrhea. Amenorrhea is absence of menstruation for a woman in her childbearing age for 2 or 3 consecutive times in a row, for 2 or 3 consecutive months in a row. That is amenorrhea. This occurs when the ovaries are not producing enough estrogen for that particular woman, and especially for young girls who started menstruating early. You find out that they will menstruate for the first month, and the next month the thing ceases for like 2 or 3 months. This is as a result of estrogen not producing, not ovaries not producing enough estrogen to be able to maintain this cycle. But after a couple of months, they find out that it regularizes. That is normal for these young girls. But for a lady who has been menstruating and suddenly the menses ceases to come for some months, this as a result of the ovaries not producing enough estrogen, and you need a medical attention. You need to see your doctor to know why this is happening. Then again, rapid weight gain or weight loss, especially for those who are on diet therapy. You are trying to watch your weight and you notice that you are not seeing your period again. It is because the system is destabilized. You're not getting enough nutrients. So you need to know that you need to adjust your diet in order to get your system regularized so that you won't miss your period anymore. Then stress, intense stress destabilizes that part of brain that produces hormonal reproductive hormones. When this happens, you won't be able to see your period again because stress destabilizes the brain. And it is a thing of the mind. When the brain refuses to recognize the fact that it should produce these reproductive hormones, you miss your period. When a woman is producing excess prolactin, prolactin is breastfeeding hormone, and it's what makes a woman to breastfeed the baby effectively. And most times, when a woman is breastfeeding their baby effectively, he misses her period, and as a result, there's no ovulation. That's what we call lactational amenorrhea. At this time, the woman will not be fertile, and that is why we encourage women to breastfeed their babies effectively so that they will be able to monitor their ovulation or to check the ovulation so that they won't get pregnant when their baby is still tender. It is using as a birth control so that they will get pregnant when they want, not when they are breastfeeding, they will get pregnant. When you do that effectively, you see that menstruation will cease, and as a result, there will be no ovulation. So when a woman who is not breastfeeding and is not pregnant is lactating, it's a problem. It causes amenorrhea. Then polycystic ovarian syndrome. Polycystic ovarian syndrome causes hormonal imbalance, and this makes a woman to miss her period, and you're not pregnant. You're thinking you're pregnant, you're not. You need medical attention. You need to see your doctor. Then excessive exercise. Intense exercise for the athletics, those who do exercise, especially for women. This thing destabilizes, it causes stress on the reproductive hormones and causes amenorrhea, that is lack of period. You will not see your period again because the system is destabilized. Remember I told you it's a thing of the mind. When you don't rest and sleep appropriately as a result of stress, it causes missed period. Stress destabilizes your system. When you don't get enough rest after the work you are doing, or your work is that which puts enough tension and stress on you, it causes imbalance in the hormone, thereby causes missed period. Then again, premenopausal syndrome. At your reproductive age, you're approaching menopause. You find out that most times you miss your period. This is as a result of premenopausal syndrome. Then thyroid disease. Thyroid is one of the glands that produces hormone, and when it is diseased, it causes missed period. So try and check yourself and know once you miss your period and you're not pregnant, you need to see your doctor immediately so that whatever problem that is causing the missed period can be sorted immediately. Especially if you are stressed out, this can be sorted immediately by you taking enough rest and sleep. If it means changing your work, especially if you're waiting to conceive, it means changing the kind of work you're doing so that you get pregnant. You need to do that because stress has a lot to do with your reproduction. Thank you for watching. I hope this finds you well. Please give this video a thumbs up and subscribe if you have not. Thank you for watching. Remember to follow for your health matters.